Hi, welcome to CT Guided Biopsy at ctbiopsy.com. This is Dr. Bhavin Jankaria, and today we're continuing the spine biopsy series. And the last time it was a transfacet joint approach. Today we're looking at a translaminar approach. So the 65-year-old known to have CA breast, which had been metastatic, had a focal osteolytic lesion in the S1 vertebral body. This was picked up because of pain, and you can see that on the MR. It's a body lesion that extends into the anterior epidural space here. And she was referred for a CT guided biopsy. And this is what I basically had, that's the nerve, that's the thecal sac. Can I find a space between the two that is safe enough to be able to get into this lesion here? The CT scan showed a path, but it's seen much better when I actually started doing the biopsy. And you see that in the prone position. If that's, and don't forget that while there are nerves here, there's no CSF here. This is fat, and the sac actually is extremely thin and small when it gets into the sacrum. So really what you want to avoid is damage to the nerve in the foramen, damage to the nerve in the lateral recess, and there is a little strut of bone, you can see it on the other side, through which you have safe passage. In fact, if I were to go a little bit through the fat of the foramen, that would also be fine. Pre-procedural was okay, normal coagulation profile, material was needed for histology and microbiology, but in the end we did only histology. The procedure, the checklist was fine, and here's the 11 gauge Cook, which was my go-to needle for penetrating the bone. This is done under intravenous sedation. Now here, this is the critical thing where I just need to make sure that I've reached and positioned it correctly. So once I'm here and I know that I just need to go between these two nerve roots, then it becomes reasonably easy. So here I am, I'm a little off center, but you can manipulate the needle um, at the skin level, and the bone can be yielding. So here it is. You can see how I've changed the angle just a little bit between these two, and now I'm in the lesion. Again, eccentric, but once I deploy the gun, I'll be through the lesion. So here it is. That's the gun, the 18 gauge Bard. I have enough play here, and I got enough cores as well. So that's what finally has happened. That's the track that you can see here. No deficit at the end. Patient was absolutely fine. Working diagnosis was met, and that was the final diagnosis. And that's the summary. We're looking at an S1 body. Took a translaminar approach, took 12 minutes, level of difficulty 4 by 5, and just got 5 cores for histopath. And so earlier I used to talk about all these approaches, but I didn't have the translaminar here. And we've had, if you see the table of contents, we've looked at perivertebral, transpedicular, transsacral, especially for L5S1, the perivertebral posterolateral, and lastly was the transfacet approach. And for the sacrum, we've looked at these posterior approaches, either of the ALA, which is usually very simple, or a perisacral approach. But here now there is a new approach, a translaminar approach, which is not something that we would do commonly because you have the thecal sac right in front of the lamina. So the only times you would use this in a situation like this, which is in the sacrum, or in a post-operative case where the lesion is, where the anatomy changes, or when the lesion is posterior subjacent to the lamina, which could happen with tumors or osteolytic lesions, etc. So one more approach to consider and think about. Again, it's all about using our minds and brains to find innovative approaches to these kinds of problems. So don't forget the table of contents. We have so much stuff there. And if you like the other sites and cases that I do, that's at Atmos First. It's a little more philosophical topic here. That's the book. I just published this quiz at BST Neoplasms. You can participate in the quiz at this site. I just put this up earlier this week on pulmonary arteriovenous malformations. That's the case of the day that I do every day from Monday to Thursday. You know where to comment, email, subscribe, etc. Thank you so much for viewing this.